Just a big thank you to the WA Primary Health Alliance for the opportunity to talk to you all today about the Australian Immunisation Register. My name is Michelle Cusack and I'm an AIR Business Development Officer and I'm based in Perth, and I've been working in the AIR since 2016. So today I'll be presenting some information for you all on PRODA and how to create an individual PRODA account. And probably more importantly, we'll actually demonstrate that in our PRODA test site. Then we'll also go on and access the AIR website, and we will record some vaccinations that I think have often been questioned by our AIR team as to how it is done. So we will do that, and we will log in and do some overseas vaccinations, and also for some individuals who are not eligible for Medicare, so you don't actually have a Medicare number for them, and we'll show you how that is done. And then finally, to end the session is just to make you aware of some of the really useful education resources that we have on our website. And you'll see there are some simulations and some infographics that can also help with any questions you might have with regards to AIR. And also, as Fee mentioned at the end, we hopefully will have some time for some questions. But if we don't get to all of them, we will be collating the information and the questions, and we will send that all out, the answers and the information to you at a later date. So, what is PRODA? For those of you that might be new to PRODA, it does stand for Provider Digital Access. It's an online identity verification and authentication system. So what it does is it lets you securely access government online services. To explain it simply, if you've got a MyGov account, it's very similar to that, but it's your gateway that enables you to access the online services with various government agencies. You'll only ever create one individual PRODA account. It does belong to you. So if you're working at a practice and then you move on to another practice, the organisation may have added you as a member to the PRODA org for that form of employer, and then they will cease your access, but your individual account travels with you and belongs to yourself. So there are 3 steps to create a new account. But most importantly, if you don't have a PRODA individual account at the moment, what you'll need to do first of all is ensure you have your 3 identification documents with you prior to commencing your registration online. Very shortly, I'll be demonstrating why that's important to have the documents with you, but make sure you've got those. Then you go to our website, which is www.servicesaustralia.gov.au, and from there, the sign in on the right-hand top screen, and you select PRODA. So make sure you always go directly to our website when you wish to access PRODA. And that's because if you save it as a favourite, sometimes when our website is enhanced or there are changes made, it will break the link and you will have problems. So it's always best just to go directly to servicesaustralia.gov.au, and that can solve some of your problems you might have had if you hadn't. So step 1, create your account. That's the registration process. Step 2, verify your identity documents. And step 3, link your PRODA account to online services. For example, HPOS, which is what we need for AIR. Okay, so now I'm just going to take us across to our test site. So whilst this has got some extra information there that won't show when you're actually creating your own individual account, this is actually very similar to what you would go to. So you can see it looks like you're going to log in, but down here, if you do not have a PRODA account, we click on here to register now. And again, it tells you that there are 3 steps to create a new account. Create your account, verify your documents, and you can click on here just to see the sort of documents that you will require the information of to verify your identity. Now, I appreciate that perhaps there might be some people online tonight that may not be able to supply these documents as listed, and there is provision for assistance with regards to that if that's the case. So our PRODA team can assist you in that. Now, down here is the button we want, register now. Woohoo. All right, so this is rather simple and easy, obviously. Your title, not compulsory, but you can choose, obviously, whichever is applicable. And then you pop in your first name. Only pop in a middle or additional names if they do appear on your documents. So let me just check. Jupiter. I should have had that there. Nope, Jupiter's good. And then surname and gender. We do have the 3 options there. So female and date of birth. And next. Just a warning, if you have any additional names, which we don't, we're going to say no. Now you choose your own username. Now, I would just warn you that if you ever do need assistance and you call our PRODA team, your username is on display to them. So always wise to keep it as not a password or anything terribly private or obviously inappropriate. But you can choose anything you like there and pop it in, and then your important password. So the usual 10 characters, uppercase, lowercase, and at least 1 special number. So we'll pop. Always need to make sure they match, so I just take my time a bit there. Okay, and next. All right. Now, these security questions are important because we all lead very busy lives, and there are some websites that every time I log on to it, I have to reset the password. So just make sure you do remember what you pop in here. So you can choose, obviously, you can see there the name of your pet, the first street you lived on, holidays, favourite books, albums, etc., etc. So I'm just going to choose a couple of those. And then move on to the next one. Model of car I learnt to drive in is always a good one. And down here, first live concert. For some of you, you may not know who this person is. For others, you'll be going and saying she's showing her age, but never mind. And next. Okay. So the first thing we need to verify is our email address. Now, I have to use a specific one so that I will get the actual code that we're going to send out. So just bear with me. I have to put this would obviously be your email address. Now, we do recommend that you use your personal email address, but of course, that is reliant on whether you'll be able to access it in your workplace. If you have a unique individual work email address, then by all means you can use your work address. It's just simply you obviously can't use a shared email box. Now, have I got those right? I forever forget to spell Australia, which is rather embarrassing, but anyway, let's hope I've got it right. Yay. Okay, now I just need to get the code that I was just sent. Okay, this just, of course, just verifying the email address that I popped in there. So you will receive that code yourself, which, as I said, is important that you're able to receive it if you're doing it in the workplace. Okay, so we've got a nice green tick because we've successfully created our account. Now we move on to verifying our identity. So next. All right, so this is where I choose the first document that I wish to use. So I'm going to have a look at the list, and this is where I'm going to choose the Australian passport and go next. And you'll see it's populated my details, Jupiter and rain, and I pop in my document number. and next. It's doing a background check there, and it's come up and said your Australian passport has passed online document verification. So that's what we want. The next one I'm going to choose is my driver's license, and next. Just choose the state that your license is held in. Okay, so I need my license number. And of course, we've got extra security these days. And so on the back, I'm just going to get that number there, the back of the actual license. Go and next. Again, doing the background check. Right, so my driver's license has passed online document verification as well. These are the options here. I'm going to use Medicare just so that we can get through so that you can see it's finished. But this is where you would go, I don't have any of these documents, and click next. There's a form that you can print off and complete, and then you begin a dialogue with our PRODA team, and they will let you know of the other options available to you if you're unable to supply these sorts of documents. We can for tonight, and we're going to click the Medicare card. And we're just going to pop in our details there. My individual reference number, often abbreviated to IRN, and the expiry date. That's why it's important to have it with us, because you've got to put in all the details. It's no good just having the number. You won't actually get through the process because you must have your expiry date of your Medicare card. Okay, another tick. We now have verified our documents. You can see how quick this can be if you're prepared. So it really should, if you've got everything and your name matches on all your documents, it should only take you 5 or 6 minutes. If one of your documents varies with a surname change, just have the document that actually instigated that change. So the certificate of marriage, the document, the item number, my goodness, the number of your marriage certificate, and then you will still be able to go through the process. So we're all good, and we're going to click next. Now, we do use the two multi-factor verification, obviously, for security purposes. So it's not just enough that I've got a username and a password. Every time I log on, I need to get a verification code, and that will go to either an email address, as I mentioned before, or you can have it to the mobile app, PRODA mobile app, which is available, or onto your mobile phone. Now, again, that will depend on your workplace and whether you're permitted to actually, collect a code from your mobile phone. Email is fine, long as, of course, you can access it. So we'll leave it to email. And now up here, I've got my name and I've got the information about PRODA. So just before we go into HPOS to show you how to do that, if ever you need your registration authority number, so you've gone through this process, you've created your PRODA account, we do send you an email to let you know what your RA number is. But if you ever forget it or, have deleted the email, if you log on and go to profile, you will find your registration number there. And as it says, this number is required for HPOS delegation, and that will be either giving it to one of the providers that you might work with, or if your organisation has registered, to your organisation. So there it is there. It's also a place where if I decide, or if I do move on and I need to change my email address, I can do that. And I can also at any time change the means by which I do get my code to a mobile phone or what have you. I can update the details all on my profile. So at this point, of course, I don't have access to anything. I verified who I am, but I'm not a health professional, so I don't have any access to Medicare or to AIR or anything like that. So what I need to do is go to services. And what I want to add is HPOS. health professional online services. So I click on this option. Okay. And what it's asking me is, do I have any identifiers? So in the case of a provider, I would have a Medicare provider number. I might have an APRA number, anything like that. If I'm a pharmacist, I probably have a pharmacy uh, provider number. So in this case, though, because Jupiter doesn't, I'm just going to say no. And that's what a nurse would select, or a staff member would select. No, I don't. And then I'm asked the question, am I a responsible officer or an organisation maintenance officer for eHealth? And I'm going to say no to that as well. Okay, but I have now linked HPOS. So I can go to that service, and it's just decided to have a little moment. My apologies. Okay, go to this service. We'll just try one more time. This is the joy of the test environment. Thank you. All right. So the very first time that you log on to HBOS, you will be presented with the terms and conditions of use. And of course, once you get access to AIR, you are accessing private and confidential information. And so what we're saying here, basically, in all of this, is that you're only accessing information required in the performance of your role, and that you're going to keep the information secure. So you must agree. If you disagree, or decline, I should say, you won't obviously get access. So we just agree to that. Now, this is important too, because further on, I'm going to show you a means to contact AIR without actually having to call them. But this is the email address that is your regular email address, because if you use the HPOS messages, we will reply in HPOS because it's secure. But you might need to know that there is an email waiting for you in there. So in here is where you would put your email address, and you just confirm it. You can give us your mobile number, but it's not compulsory. Now, this is the important question. Make sure you say, yes, I do want to receive notifications, because we will only be sending you an email to let you know there's mail in your HPOS mailbox if indeed you've contacted us in the first place. So you can have it immediately if you like, weekly, daily. An immediate notification I would recommend, because that way, if you've asked us a question and the AIR team come back to you, as soon as it's in your HPOS mailbox, you'll get an email in your regular work email to tell you that you need to log on to HPOS because you've got an answer. So that is what we do there. All right, so that was how quick and easy it is to actually create your own PRODA individual account. What I'm going to do now is I'll just go back to our presentation, and we will go on to just recapping or just reminding you of a few of the responsibilities, as I said, about the privacy and security, because your use of PRODA and HPOS and AIR is governed by laws and government policy, and failure to take reasonable steps to protect the information from misuse or disclosure is a serious offence under several pieces of legislation, including criminal. So the important thing here to remember, there are two key obligations, is that you use these programs securely and for proper purpose, and you must not share your secure access details with anyone or allow any unauthorised person to access our programs. Okay, so we've created our PRODA account. Now, what can we do with it? Right. To access AIR, there are two means to do so. If you work in a medical practice, or if you work in a pharmacy, or perhaps even in a hospital, etc., you may have practice management software or pharmacy software that you can actually interact directly with the AIR, which is great. You can click a button and ask for someone's immunisation history. If you don't, then of course you can always use the AIR site. And sometimes, even if you do have software, it may not have the full suite of all the functions available in the AIR site. So it's a great complementary tool, so to speak, to have the AIR access as well. Excuse me. And also importantly, the immunisations that you will have for a patient are generally just the ones in your system that you have given in your own database. You need the air to check because they may have had an immunisation or a vaccination, I should say, elsewhere. So to access the air site, you will need a PRODA individual account. Now, let's log on to PRODA and go to the air site and do a live demonstration. So just bear with me a moment. I am going to get out of that one when I can. Okay, and I'll log out. All right, now I'm going to log in to another account that does have access to air. Whoops, what if I misspelled that? Right. So still the same path to log on that we did before when we registered. And I get my code. Okay, so this is similar as you saw just a moment ago. I've got myself up there, profile, and I'm going to go to health professionals because that's where I find the air. Right. Now, because I work both, this is obviously not myself really, but in this example, Anastasia, she works in a practice, but she not only is a delegate for some of the doctors in the practice, but she also works quite a few jobs, poor thing. She works in a pharmacy and all the rest of it. So when I'm logging on, I must make sure, how do I want to proceed today? Today, I want to proceed as an individual and log on under one of the providers that I work for. So I'm just going to choose no organisation and proceed as an individual. Okay, so this is the welcome, the HPOS screen. When you first log in, it's got your name up the top. We do sometimes have some banner messages that are just there that you can have a look at. And you've got my programs. So it's my programs that we want to go to air. So if I click that now, you will see the different tiles, and none of those say air. And that's because I've missed an important step. Now, I have actually done that deliberately. I haven't lost the plot, so to speak. It's just we do get a lot of people that phone us up and say, I've lost my air tile. And it's simply because they've forgotten one step when they've logged on. So what I need to do is go to my providers because I'm going to log on as one of the doctors who has delegated me to act on their behalf. So you can see here in the past, I had this one, might have been at a different practice, it's expired, and this one here is my current one. So I select that I'm going to act on behalf of that doctor. And now you'll see it's telling me I'm acting on behalf of Michelle Cusack. And if I go down to my programs now, I have the air tile, and that's what I want. Okay. The first question you're going to get is about the healthcare provider identity fields, numbers. So the first one is the HPII. Now, if you have it, by all means input it. And if you have an organisation one, by all means. You'll notice there's no red asterisk, therefore it's not compulsory. So you can just click next. And there's the welcome stream. Welcome. I think I'll just have a bit of water, sorry. The welcome screen to the AIR website. So what predominantly people use our website for is to go into the left-hand side here on the menu and identify an individual. Now, I'll just point out here as well, you use either a Medicare number, an individual healthcare identifier, or the person's individual details. I have in the past just spoken to people and they've been putting everything in. You don't need to do that, of course. So the Medicare number is great if you've got that handy or if you've got it for the individual. So what we'll do is we'll just pop in one here. And then we just click search down the bottom. Okay, so up the top here, it's got the details of who the person is that I've called up. I've got their address. I have their current Indigenous status, and it's telling me this person has COVID-19 certificate. I can use the return mail indicator. That is if mail has been sent out from your organisation to this person and it's been returned. And I can also, with the person's consent, update their Indigenous or non-Indigenous status. Coming on down, we can see due details. Now, this is an adult, yes. So we don't actually have any due vaccinations that are due. And down here, I can click on that little arrow and I can see what we have already on their immunisation history. And I can also, if I wanted to, generate the certificate for them if they needed their immunisation certificate. So to record an encounter for this person, we just click here on the left and record encounter. Now, the first question is who performed this encounter? Now, the options are I performed this encounter, meaning doctor has performed it and I'm entering the data, or I've performed it on behalf of the doctor, being the doctor's nurse. So it doesn't necessarily mean if this was an organization, for example, and that was, the name of the practice, I perform the encounter is implying that it's from the practice. It's not the person who's actually logged on. So it's not Anastasia as such. Anastasia could well be a receptionist or the practice manager. Hasn't performed it, but when we select I performed, it's for that organisation. Then we've got a question if it was performed at school, optional to fill that in, obviously if it's applicable. Data service, and we just click in there. And in vaccine brand, if we just start to input something like, let's think, Japanese, there we go, we will get the different immunisations that belong to that, and we'll choose that one. Batch number, of course, needed, and we can add. Now, at this point, if I had realised I'd made a mistake, you'll see I've got a trash can and I can just delete it. It's the only time you can actually delete something that's on the air. Once it's on the air, there is no provision for you to actually remove it. You will need to contact air to get it removed. But at this point in time, because we haven't submitted, if we realise we've made a mistake, we can hit delete and we can remove it, or we can hit edit. And perhaps I had chosen the wrong one. Perhaps it was the other one. I've forgotten what the other one's called, but we'll just grab that and then update and submit. Okay. Now, if the person didn't have Medicare entitlement and hadn't arranged an IHI for themselves, I can still, and we would like you very much to, still enter in their immunisation details. So what you need to do is pop in name that's not problematic. Right, there we go. Surname, first name, date of birth. Now, if you click the year, you'll be able to go back. Just a tip there, makes it a little easier. There you go. And then gender. And I don't have to put in a postcode range because that will do an Australia-wide search, and click search. Now it's telling me that the individual has not been found, and it's asking me to please check my keying. And the reason we ask you to do that is obviously what we will do is we will create a record for this individual, and we want to make sure that we don't end up with duplicate records, obviously, for this person. So it could be, for example, she spells her name the same as myself. So just double check everything and then search again. Still going to get that message. This person doesn't have a Medicare card for us to use, and we'll go ahead and record the encounter. Now, because we don't have any number to refer to, so that's a Medicare number or an IHI, you're now being asked for the address. So make sure that that is correct and up to date. Just input the address. And next. and then you get the same details that you would for someone that's on Medicare, so to speak. So we've still got the same lady up the top there, and who performed this encounter. I performed this encounter, or perhaps it was performed overseas. Perhaps she's come to Australia from overseas. So we would choose this was performed overseas. Country of immunisation. We would select from the drop down. We'll say she was from Finland, and the date of service. And again, just click on the year, because especially if it's something in the past, saves you scrolling, February 14th, and then you can start to input what she may. Now, with batch numbers for overseas vaccinations, you may not have a batch number, and that's fine. It's not like you've selected, I performed it, and you haven't got the batch number. This is performed overseas, and you don't have a batch number. So what we'd ask you to do is just one word, even though it's two, no space, not recorded. And that's acceptable because it is from overseas. You've told us what it was, and we can add it. And again, we get that last check before we enter, just to submit and submit. Now, that is not going to show straight away for you if you were to look down here on the history, whereas, some people do, so to speak. And that's because we will be trying to match that person. We will check the address and the records that we've got in our system, and we'll be looking to see if there is an earlier record. So that's why it's important that when you do submit, double check when they're not on a Medicare card or have an IHI. Just be that extra bit cautious that the surname, first name, date of birth, and the address are all correct, and that if you do perhaps have that patient come back in a week's time or anything for follow-up immunisations, that you then input exactly the same way. Okay. All right. Now, back to our presentation. Now, I just want to touch on the education resources that we have, because we've been updating those on our website to try and make them, more up to date and more user friendly for you, so that you can, go through a simulation, so to speak. So on our website, we have education resources, so you can go to that through hpe.servicesaustralia.gov.au, and you will find education resources for all of our programs. You've obviously got Veterans Affairs and Medicare, etc. We've just highlighted there for you the Australian Immunisation Register, HPOS and PRODA, which are probably more likely to be necessary for you tonight. So what you will do is you will go to our website, go to the Health Professional Education Resources Gateway, and as you can see, we've got the Australian Immunisation Register. So if you click on that, you will get the options here. So you can see if you need to register as a vaccination provider, that would obviously be for a practice perhaps. And then you've got accessing the immunisation register, submitting information, the overseas immunisations that we just went through, medical exemptions if they're applicable, how to log on using HPOS, and then this one here may not be applicable to everyone this evening, but registering an organisation in PRODA to access the air as well. So all of these information, infographics and also e-learning modules are there as a reference point, and we'll be sending out this information later. Now on here we've got the infographic slides that I was talking about and the e-learning, and you've got all your details there that you can take for information and for assistance. And all of them are optimized for use on both PCs and tablet devices. Fee, do we have any questions?
Thanks, Michelle. We do have a few questions, and I just firstly want to apologise for forgetting to introduce myself at the start of the webinar. My name is Fee Franey, and I'm the Senior Manager for Primary Care Development here at WAFA. So we do actually have some questions that some of them people submitted before the webinar ahead of time, which is great. So I will just get a couple of those, Michelle, that we can start with. So the first one is, how can we change the dose of a vaccine, edit a mistake, or correct an error other than calling AIR to enter a request for change?
Okay, great question. Let me get back in here. So if we did need to change something, and it was actually something that our practice or our doctor, it had been recorded under their provider number, you can actually go in and edit that yourself. I'll just show you. You bring up the individual's history as you would normally. So we just click on search. Okay, so this is the person. Now on the left-hand side of the menu, there's an option to update an encounter. We just click that. Now, this is remembering that it must have been, the initial immunisation must have been recorded under the provider number that I'm currently acting on behalf of. So you can see for this child that all of these immunisations here, there's no little edit button, which means I can't make a change to those because I must not have been responsible for the inputting of that data. It must have been, obviously a different practice or what have you. Certainly I can change this one, and I certainly want to, because if you have a look, poor old Mushroom, and I do apologise for these names, some of my colleagues really. Mushroom is a child, 5 years of age, and we've put through a flu shot, which is the over 65 flu shot. So obviously that has to be an error. So we click on edit, and now we can actually change everything. For example, had I not been the person that performed it, had it been done by another doctor in Australia or another provider, or had it been performed overseas, I can change all of that. I can change the date of service if that was wrong. I would leave the schedule as other because it's the flu shot, but also, of course, I'm going to change what that vaccine was because it was flu quadri, not fluid quad. And then I pop in the new batch number and I hit update. Now, you'll notice in this case, immediately that has been amended and the AIR now reflects the correct vaccine that was given. There are other times when perhaps you might not be able to edit as well, and not just because it was a different provider. If it was a vaccination that was eligible for a payment and the payment has been made, then you will not see the edit function either. But instead of actually calling our AIR team and having to get that fixed over the phone, what you can do is in here, in your HPOS system, you'll see we have messages and we have my mailbox. And what we can do here, just ignore these ones, these are just testing ones. But this is the mailbox I was talking about before when we set up our PRODA account. You can compose a new mail in here, and this is secure because this is in HPOS. This isn't your regular email. And you don't even need to know the email address because from the compulsory drop down, obviously we need to know where you need to send it. AIR's number one, of course. We select AIR. Subject, perhaps it was, a child's, or I don't know, MMR or something. MMR, Michelle. And then you can actually pop in their personal details there and let us know. Perhaps you put through the wrong dose number, whatever it is that needs to be actually changed. Give us all the details, the Medicare number, or if they don't have a Medicare number, the full name and the date of birth and the address, and send that through to us. That goes securely to the AIR, and then they can make those changes for you. And long as you've set up in your settings, it doesn't want to accept, there it is. Long as you've set up in here your email address and that you want to get immediate notification for your emails in HPOS, then say it's 2 or 3 days later, whenever, your regular email address you will get an email telling you there is mail in your HPOS letterbox, or mail centre, I should say, and then you'll be able to log on to PRODA, log on to HPOS, and go to your mailbox, and you will have an answer from our AIR team. So that's just another way that you can do that.
Thanks, Michelle. That's great. So the next question that we have is there a helpline number? And this maybe you probably covered this, I think, Michelle, in that one, but is there a helpline number for AIR to assist with incorrect data input rather than waiting on a call to be answered with the general public?
Right, yes, we do just have the one telephone number for general inquiries, but option 3, I don't know if the person asking the question is aware that with the, I've got the wording, what is it, interactive voice, but you know the option 1, 2 or 3. Option 3 is for health professionals, so whilst you're calling on the same telephone number, option 3 is identifying that you're calling as a health professional, and so it's a queue within a queue, so to speak. So there's always that. If it is a internet problem, so say you are using the AIR site and you encounter a problem, there is a specific phone number for AIR internet support, perhaps people are not aware of. So that is definitely another option. And then, as I mentioned, you can always use the HPOS messages to send an email to AIR as well with regards to any topic that you needed assistance with.
Great, thanks, Michelle. So one here, newborns and infants without Medicare, do we hold off sending in a vaccination encounter, or do we create an AIR account, potentially creating a duplicate account?
Right, yeah. Look, we would prefer that people didn't hold on to them. I understand why you may wish to, but if you do use the identify the individual, and if you're just making sure, if you've definitely got the child's correct surname, first name, date of birth, and then as you saw, we need the address as well. Our system, we do constant overnight checks to try and match data up. So, you know, if you pop it through today and the child's registered in a week or two's time, we will marry them up. And we sometimes do, definitely, you're right, end up with a duplicate record, but we also can marry those up as well so that we can link the two and make sure there's only one record with all of the immunisations rather than two separate records with bits and bobs, so to speak.
Right. And a couple more. So one, other than hospital discharge summaries, where can we find a patient's IHI number?
We don't actually have a means on here to actually look for an IHI. I believe in software, you can search there. Some of you might know better than myself, but in software, of course, you can search or request an online patient verification, which will give you the Medicare number. And it can also give you an IHI as well if the patient has one, or in the case of a patient that doesn't. But there isn't a means to search in the AIR for an IHI or a Medicare number.
Okay, thanks, Michelle. So there's one here. If a person has had multiple 3 boostrix in the last 5 years and not one is listed on AIR, so the nurse has followed up with the GP with the exact dates the vaccinations were given and they don't have it recorded, are we able to update the AIR with the correct batch and date details ourselves?
Yes, if there aren't any records on the AIR, you would be able to record it. So you would record the encounter from the point of view of, you know, if it was performed elsewhere in Australia, and you would input the details.
Great,
And
thank you.
just to footnote that though, again, if you'd noticed there was an immunisation record for your patient that was incorrect, you can't correct that, of course, unless you can only correct your own entries. But that's when you could use the AIR website, the HPOS, to actually go in and send that through to us to get it corrected.
Right, thank you. Let me just see. I think there's just one more. Do we have to re-enter all the vaccinations that have not transmitted to air from our practice software? Successful transmission is intermittent from our practice, but we don't know why. How can we resubmit the details?
Okay. If we're talking about a large volume of immunisations that have not gone through, my first suggestion would be to go back to your software vendor, because I'm pretty sure there is a means in the software to get those resent. But otherwise, as you've seen on the air, I mean, you can add up to 5 at a time. But if we're talking about, quite a lot of immunisations that are missing, then I would definitely be trying to get your software to do it for you, rather than you having to log in here and do it one by one.
That's great. Thanks so much, Michelle.